Thanks much, Honorable Minister. Your Honor, Ministers of State, heads of agencies, our partners, I can see WHO here, friends from the media, Ghanaians. I provide this date as a follow-up of the press brief by the Minister of Health and Information that announced the first 2 confirmed COVID-19 cases and consequently declared the outbreak in Ghana on the 12th of March this year, 3 days ago. Both individual index cases returned to Ghana from outside the country, one from Turkey and the other from Norway. Hence, the 2 cases were both imported. The first case is a man, resident in Accra, who returned to Ghana from a trip in Turkey on the 29th of February this year. He developed symptoms on the 10th of March and reported to a health facility on the same day. He was identified as a suspected case of COVID-19. Sample was taken same day. The sample was sent to Noguchi Memorial Institute Medical Research, and within a short while, we had the report from Noguchi confirming that Ghana has confirmed the first case of COVID-19 in the country. The second case is a 60-year-old man, a Norwegian, who returned to Ghana, Accra, on the 7th of March. He started developing symptoms on the 12th of March and reported to a doctor on the same day. Sample was taken, sent to a laboratory, specifically Noguchi Memorial Institute Medical Research, and we received reports later in the day indicating that this is also another confirmed case of COVID-19. The 2 reports came the same time because the samples were sent and they were worked on the same time. So we had simultaneously 2 confirmed in this case on the 12th of March this year. For both patients, cases had no symptoms on arrival at the time of crossing our borders. And later, they presented with acute respiratory illness. We had evidence of exposure. They had been to areas where cases had been confirmed. Both cases are currently being treated under isolation conditions, and the 2 are stable. Contact tracing has started. I'll give details later, and it's ongoing. On Friday, the 13th of March this year, 2 days ago, not too far, 2 more cases were confirmed as COVID-19. They reported in 2 regions, one each from Ashanti region and the other Greater Accra region here. The first is a 56-year-old man, a Ghanaian, who returned from a trip in the United Kingdom on the 4th of March. He stayed in UK for 10 days and came back. He developed symptoms on the 12th of March, reported to a hospital in Obuasi, and the case definition met the case that of suspected COVID. Samples were taken. The sample from this case was sent to Kumasi Collaborative Center for cases for research. And within a short time, the lab reported back to us that they have finished the assessment of the report, and this is another confirmed case of COVID in the country. The second is a woman, a female, and a student, Ghanaian student. She traveled out to the United States of America, stayed for I think 10 days or so. She came back on the 9th of March, and then on the 13th of March, she started having symptoms that later were evaluated to be compatible with a suspected case of COVID. Samples were taken, sent to Noguchi Memorial Institute of Medical Research. Samples were taken on the 13th. The same day, we had a report from Noguchi that confirmed this as another confirmed case of COVID-19. Both are currently receiving treatment under isolation conditions, and both are stable. I'm talking about the two of them that were seen the 13th. Yesterday, late in the afternoon, we received a report of 2 new confirmed cases from Noguchi Memorial Institute of Medical Research. The first is the 42-year-old Ghanaian male who returned to Ghana on the 8th of March. He had traveled to Switzerland and UK in the past 14 days. Symptoms started on the 9th March, and he reported to the health facility on the 14th March. Samples were taken, sent to the lab again, Noguchi Memorial Institute of Medical Research. Within a short while, we had the report, and this was confirmed positive. The second case was a 41-year-old Ghanaian male. He reported to Tema General Hospital on the 14th of March with a history of fever and acute respiratory illness. This symptom started on the 10th of March. This case had traveled to Germany and Turkey within the last 40 days. Samples were taken, sent to the lab, again, Noguchi Memorial Institute of Medical Research, and the report came back as positive COVID-2019. Both cases had no symptoms on arrival, but presented with symptoms of fever and acute respiratory illnesses, and they were not having signs and symptoms time they are crossing our borders. Both are currently under treatment in stable conditions. Contact tracing has started. This brings to a total of 6 confirmed COVID-19 cases in Ghana, with no death. And this is the situation as at close of 14th March 2019. That was yesterday. All the cases are small. All the 6 cases were imported into the country. Distinguished ladies and gentlemen, permit me to use this opportunity to remind all Ghanaians and people living in Ghana to adhere to the preventive and precautionary measures. Key among those are as follows. Wash your hands regularly and thoroughly with soap and under running water, and use alcohol rubs, sanitizers frequently. Avoid shaking hands. Cover the mouth and nose with tissue when coughing or sneezing. Dispose of the tissue immediately into trash bin. Keep a distance of at least 2 meters away from a person with fever, cough, sneezing, and difficulty in breathing. It is advisable to be physically active. Everybody is advised to drink plenty of water. You have to eat healthy food, avoid stress, have enough rest, have enough sleep. Restrict travels to essential travels only, as directed by the Excellency, the President. Stay home if you feel unwell and symptoms of fever, and having symptoms of fever, cough, and difficulty in breathing, and call the following number immediately for help: 0509 497 700, 0558 439 868. Before I take leave of you, Just a brief about the details of the various cases that we have had with respect to the contacts that we are managing. First 4 cases, contact tracing has started. The last 2 cases we just confirmed over the night, and we have started mechanisms to identify the contacts. Case 1, the contacts, the location, there's a man called Seth. The location, we have identified 2 contacts, and all the contacts are being traced. Case 2 is a Norwegian. You have identified 107 contacts, and 68 of them, you've started process to follow them up. The rest, in the close of today, you'll be in touch with them and support them with regards to their contact tracing. Case 3 is a student, and out of the various, for now, we have identified 12 contacts. We are still in the process to work assiduously to get more, and the last case, the 4th one, and the place of residence is Obuasi. Currently, we've identified contacts, and all the 30 contacts are being followed up. Thank you very much.